Welcome to Oncology Data Advisor. Today I have the pleasure of being joined by one of our editorial board members, Dr. Lauren Ghazal. Thank you so much for coming on today.
Thanks for having me.
To start off, would you like to share a little bit of an intro about yourself?
Oh, yeah. So hello, everyone. My name is Lauren Ghazal. I am currently an assistant professor at the University of Rochester, and also a family nurse practitioner, and just thrilled to be here and talk about a recent presentation that I gave.
Yeah, so you gave the keynote presentation at ONS Bridge this week. Would you like to share an overview of what you talked about in the presentation?
Yeah, I was really honored to be invited and it was my first keynote, real professional keynote. And so that was an experience in itself. But I felt very comfortable and there's a little less pressure with doing it virtually. But it was also, you miss that interaction with attendees too. But yeah, so I had the honor of presenting the keynote at this year's Oncology Nursing Society Bridge this past Tuesday, September 12th. And I believe I was actually invited to present following my involvement in ONS Congress's Mara Mogensen Flaherty Memorial Lectureship, more affectionately termed the MARA. And after that presentation, it was reflected back to me that my Mara presentation really left attendees debriefing and reflecting on their own practices and themselves after. And I had this portion there of kind of questioning your why and, answering questions in a reflective process that could really help you to continue on in your careers and progress in whatever way, is best for you in your oncology nursing career. So my keynote at Bridge had two main objectives. The first, to identify several factors contributing to nurse workforce sustainability, and the second being to provide participants with the opportunity to reflect their own desires and passions in pursuing a career in oncology nursing. And so to do this, I first shared some data, being a researcher, around the larger nurse workforce, and then central to oncology, and then discussed how this contributes to nursing sustainability. And so we all know that there are significant and substantial challenges to our workforce's sustainability. Our nation's over 4 million registered nurses work in every aspect of healthcare and are critical to delivering healthcare. And we know that there are evolving healthcare systems locally and nationally. And we hope that with improving the sustainability of our nurse workforce, we can improve our overall nation's health. And so I discussed challenges such as burnout and moral distress that have been, well talked about. Some would argue not talked about enough, though, which have stemmed from a demanding workload and staffing shortages and retention. I referenced one study in particular specific to oncology staff, but it was a survey of over 200 cancer care centers by the U.S. Advisory Board and the Association of Community Cancer Centers, which noted that among all their oncology staff, oncology nurses in particular had the highest rates of turnover, with about 10 to 20% of the centers reporting more than 25% turnover in the previous 12 months. And so then I also shared about, when we think about the economics of the nurse workforce, the projected inadequate supply of our workforce resulting from rising openings, coupled with an aging workforce. There's also prevalent challenges around nurses' personal safety that include risking exposure to infection, but then also assault and violence in the workplace. And we've heard in the news recently a few personal stories of really significant incidents of workplace violence against registered nurses. And then I discussed opportunities within our workforce. And one takeaway that I got from my presentation in the Mara was that while we focused on challenges, we didn't really draw attention to anything positive about our workforce. And we do have a lot of positives in our workforce. And so a few things that I shared were, we have a growing research base and research infrastructure and funds devoted to addressing burnout, nurse burnout. And opportunities to collaborate with our nursing colleagues across the globe, which I believe really strengthens a workforce. And there's an emergence of nurses being seen and heard as experts. And this increased visibility is a reflection of professional acknowledgement. And I think even just your invitation to me and to other nurses on the Oncology Data Advisor Board, recognizing, our expertise as providers here and as advanced practice nurses, as registered nurses, and being seen and heard more in the media. So that was important for me to draw on my own experiences, where I was really fortunate to be able to have a voice in that media and in publishing some op-eds with CNN, and then being asked to do an on-air interview last January with CNN. And I think it's great to me to reflect on that, as even early on in my career, to be asked not only about what nursing does and what nursing is, but from your experience and your expertise as a nurse, what do you have to share with the public, and what advice do you have, what recommendations, but also what can we learn from your experiences? And then I shared other opportunities. We have a growing body of research that has shown that telehealth and electronic health in undergraduate and graduate levels of education have allowed students to develop, skills needed to be able to embrace this utilization of telehealth and e-health and healthcare. And then last, they touched on another opportunity around advanced practice nurses with the laws and regulations that enable nurses to practice at the full extent of their education and licensure. So that was that first part. And then the second part was really more of a reflective experience. And I reflected during the keynote as well, how it was, even though I've responded to these questions that I posed to the audience, every time I do it, I take something else away from it. And so it was like they call it like a meta experience, right? I feel like you're living it inside. And so the second portion of this keynote really dove a bit more on steps that the audience and oncology nurses in particular could take to find their own why and their own voice in nursing. And so I applied Simon Sinek's Golden Circle as a model, and then also some questions that I was, was shown and taught early on during my undergraduate years at Boston College from Father Michael Himes, who's a theologian, who was a theologian, excuse me. So I went through first the Golden Circle model, which provides, really compelling evidence of how much more we can achieve if we start everything we do by first asking a simple question of why. And it's a concentric model of concentric circles, where the center circle is that why question. And then you start from that center circle and work your way out. So you start with why, which is the purpose. And you'll get questions like, what is your cause? What do you believe, right? Why are you an oncology nurse? And so I posed that out to the audience. And then taking a step to the next outer circle is the how. So that's all about the process. And these are specific actions that folks can take to realize and get to the why. And then is the what, this result portion of what do you do? What's the results of the why? What is the proof? And I reflected, a bit more on how oncology nurses really, I think we know why we get into oncology nursing and, nursing overall. But it's much easier for us to answer, what do you do as a nurse, right, on that outer circle, instead of why do you do what you do? And so I kind of flipped, that general conversation of let's all start to begin to think more about why it is what we do, and that will help us to really answer the what we do. So yeah, I had some also open like Q&A questions, and we've started to get some feedback on and asked this question in the beginning and then the end of I believe it was in one word, and we used the chat function, in one word, what's one word that you could use to describe your current practice as an oncology nurse? And I think just looking at those responses first at the beginning of the presentation, and then when I asked it to get the end, definitely a lot more hopeful, a lot more directed. and not to say that everything should be positive after my keynote, because, one keynote doesn't cure anything, but I think it starts to get folks really starting to think about that why first, and how that answering that question of the why is able to really fuel them with the passion to continue on in their careers, or perhaps, pivot in a way, and that's okay too. So I'll stop there.
Yeah, that's amazing. Congrats again on a successful presentation. I'm sure it's such a valuable topic in oncology right now. I'm curious, for those one-word responses that you mentioned, what were some of the differences between before and after the presentation in terms of what they responded?
Oh yeah. Interesting to see how, the responses change again from the start to the end of the talk. And again, a bit more hopeful. A bit before, it was just like challenging, rewarding, meaningful, yes, evolving, busy, growing, grateful, changing, but a lot of difficult, a lot of challenging, humbling, busy. And then after the talk, the way that it pivoted to me was a lot more reflective, a lot more of kind of life-changing vocation. You know, again, those evolving, ever-changing, bittersweet, influential, a little bit more acknowledging that they, and they and us, right, as nurses, actually have power over our practice, and actually have, an opportunity to amplify our voices as nurses. And I think that's what's been stunned a bit and really highlighted during the pandemic. Is, sure, at the same time we're being asked about our experiences, but there is still a bit of a silencing and a bit of, perhaps, maybe don't know what to say right now, or, I can't exactly share exactly what I'm going through because there's still a lot of trauma wrapped up with the pandemic. And so I think it was a time for folks to really pause and say, whether they've been in nursing, and we asked the question at the beginning of how long, their tenure in nursing has been. And we had folks from within 5 years to over 40, over 50 years. And so it was a good reflection for me to look back at and say, even if you're just within 5 years in practice or 50 plus years in practice, you still can do this exercise and get something from reflecting on what is the why.
That's awesome. That's been really cool to see too.
Yeah.
So you mentioned some of the things like the golden circle method for finding your why. What is some of the advice you have for nurses who are kind of reflecting on this and trying to find their why?
Yeah. I think it's really hard. I think what I did is, when I went through, each of those circles and then posed even more questions to think about that, I at the same time as presenting that, I went through my thinking and how I went through my why. And so, right off the bat, I mentioned that, like, for my why, it was, for me to fully answer it, I think it was very personal for me. And so I shared that my why was to make cancer suck less for AYAs, for adolescent and young adults, and kind of borrowing from Stupid Cancer's, real motto. But it stuck with me that was that's how I answered those questions. That's, through that lived experience, through my research, through my own professional experiences as a nurse practitioner too, and research nurse. All of those things help me to answer how, the questions around why. So, like, what brings you joy? What are you good at? What does the world need? And then, more about the why is, like, what's your overall belief in this? And, like, why do you do the job that you do? Right. And so the takeaway and the advice that I have for nurses on how to find their why, I think, is it's okay if this is a, multiple year-long process. It's okay if you go back to things and these questions. I also think that it's a good reflection to do with nursing colleagues. And also, the second part of this, the how, is really, I think you benefit from having the discussion about the why first and the how with other people, because questions around the how really get to, like, what sets you apart from your colleagues, and like, how do you fulfill your why, and what is your strategy? But the key thing of that is like, you have to know what you're good at, right? You have to know also what you're not good at. And that can be really hard for an early career nurse who's, just a few years out of nursing school. So things like or like workplace self-assessments, meeting with your nurse manager, talking with colleagues of like, I know that I'm not good at, or, proficient at this yet, or I know I have more questions about this. And, but I'm also really passionate about this. Can you help me to understand it more? Or how do I move to gaining that proficiency? That self-awareness, I think, is really important in terms of advice, because that's something it took me a bit to get. Is like, you're in nursing school for a while. If you go on to your graduate degrees, if you go on to doctoral degrees, it's a lot of school, and you're supposed to come out and be an expert, right? But you realize that you're continuously learning, and that is life. And so, I hope that folks, participants in this took back that, overall advice is that they can do these activities, but again, they're probably going to do it again, and perhaps their why will change, and that's okay. And if their why has changed, then perhaps maybe that's why they're not getting fulfillment from their work anymore. Or perhaps, perhaps that could be leading, aside environmental factors, but perhaps that could be leading to discontent too with their jobs. And so that was just to kind of put something in their ears, and help them to think about their role and their place in this really sacred profession in a different way.
Definitely. That's really awesome advice too. So
Thanks.
the last question for you is how will finding your why or reflecting on it help nurses to have a fulfilling career personally, and also help nursing sustainability on a larger scale?
Yeah, that's such a great question. And, it was a bit reflected on my takeaways, and, really bringing in the points that, right, there's significant challenges affecting the sustainability of our nurse workforce, but there also are opportunities, which I mentioned, in areas for innovation, among nurses and oncology nurses. And that we know that delivering effective, sustainable oncology care, cancer care delivery, whether through practice, teaching, education for nurses, or research, can only be provided with a robust, healthy oncology nurse workforce. And so I really believe that when nurses are able to find their why, whether early in their careers, later on reflecting back, or are okay with the opportunities and possibilities that the why could change, I think it really helps them to allow to either pivot, or pivot within nursing, pivot outside of nursing, but then also allow to contribute to the workforce in more substantial ways, which can help our nursing sustainability on a larger scale. And so, we think about nurses who, are second degree nurses. And I gave this example in the keynote of, for folks to think at their own settings, how many nurses that they work with had undergraduate degrees, or were coming from what we call like an atypical nursing background and entry into nursing. And so, were they in business before? Were they in psychology or social work? Did they have a biology background? For me, I had an economics background. And that diversity alone also, really strengthens, I think, the discussions you're able to have with your colleagues in a work environment. I think it helps to contribute to these innovative ideas, because we know we can't just be working in silos. And I think it also helps to inspire other folks that, hey, you got here in a different way, whatever different is, or non-traditional, and you're still able to, really contribute meaningfully to our workforce.
Awesome. Well, this is all really awesome advice, and such an important topic to be talking about right now. So thank you so much for coming on today and sharing all of this with us.
Yeah, thanks for having me. And if you weren't able to catch the bridge, I think they do have other recorded sessions if you did sign up in advance. And I'm sure you can share my information if folks want to collaborate or if they want to talk more about this. I think it's, like I said, really important aspect of, cultivating your practice and cultivating from a research perspective, really shaping your program of research and the rest of your career.
Absolutely. Definitely will do that. And thank you again.
Thanks.